What would your advice be to a school superintendent about what he or she should be thinking about as children go back to school in a few weeks to keep them safe?
Thank you for that question, Mr. Chairman. It is an important question, but I think we need to point out that it really will depend on the dynamics of the outbreak in the particular location where the school is. And one of the things we want to emphasize and have been emphasizing is to take a look at where you are in the particular area of the so-called opening America again. Are you at the gateway, phase 1, phase 2, phase 3? The CDC has guidelines about the opening of schools at various stages of those checkpoints. The basic fundamental goal would be, as you possibly can, to get the children back to school and to use the public health efforts as a tool to help get children back to school. Let me explain what I mean. In other words, if we adhere to guidelines of what we've heard in many of these presentations you just heard about the physical distancing in the community, the use of masks, things like that, that will help to keep the level of infection in the community down, which will then make it easier to get the children back to school. If you are in an area where you have a certain amount of infection dynamics, there are things that can creatively be done about modifying things like the school schedule, alternate days, morning versus evening, allowing under certain circumstances online virtual lessons. Those are the kind of things that we need to consider, but also importantly, always make the goal that it is very important to get the children back to school for the unintended negative consequences that occur when we keep them out of school.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.